I mean,
welcome, Brock.
and another CRNA. So he's going to leave. And that's going to be insane. You just have to watch over him. It shouldn't be hard.
If you guys have any questions, feel free to leave them in the comments.
Make sure you guys talk to your plan.
We'll gladly answer them for you. And if you guys are
turn it down.
And if you guys are interested, you can go over to our YouTube channel where we're streaming the full procedure.
Remember to do your lead now. Get 24% off for 2024. That was Heather's idea. You're a Hefe. La Hefa.
Welcome, Erica. Welcome, Tasha. Welcome, Robert. Welcome, David.
I had a H3 in the Marine Corps, and the guys, I used to open up the sunroof, and the guys would fist bump outside my sunroof. Yeah.
No, they didn't.
Yeah, they would.
Man, these are like 18, 19-year-olds. You were like they thought, not Mama Bear, you were like a, I don't know, man, you were their house mother, house dead mother.
I was.
Welcome. If you are just joining us today, we are doing a Super Daddy makeover with Dr. Jeneby this morning.
Super Daddy, we call it.
Yeah, this one's a Super Daddy.
Super Daddy, it's breast, but he's not getting implants, getting reduction. Gynecomastia, axillary plasty, tummy, and a nice juicy fruit butt. That's Dr. Katie's word, not mine.
Nice and juicy.
Don't make me a good juicy. What?
Yeah, he did.
Oh, what?
Whenever we were in the
It's like, I
pre-operative.
just want a nice juice. Oh, what?
He was like, remind the doctor to give me a nice juicy butt.
Yeah, I was like, what? Me, him, you, me? Alright, did you just say that?
It's funny.
Welcome, Tammy. Welcome, T. Welcome, Jenna. If you guys are interested in seeing the full procedure, we are streaming it live currently on our YouTube. We have a link tree in our bio, which you can go and press the YouTube button and see it there.
Can you text, can you say, Vaser bring the exercise?
Hi, Sim. Good morning.
Vaser bring the exercise?
Yeah.
Vaser, can you bring the exercise to order 2, please?
Good morning, Cindy. Good morning, Sim. If you guys have any questions, feel free to leave them in the comments below and we'll do our best to answer them. Cindy, the patient, is getting what we're calling a Super Daddy makeover. So he's doing 360 lipo on the chest. He's getting a BBL and what was the other one?
Getting a breast, like gynecomastia with breast lift. And we're getting a axillary plasty, tummy tuck, and BBL with 360 lipo. Super Daddy.
Yes.
So if you're a daddy out there, you lost a lot of weight with Manjaro or whatever. You got the exosome? You need more. Oh, okay. You want to start pulling it up? Just in case, you know, you get hit by a bus here in the next hour. 1.5. Stop.
Got it?
Plank. Turn toward me a little.
Got it?
Don't stand up so we don't think you're.
So someone's phone.
I gotta send you that, from that funny surgeon, that when anesthesia stands up, they call it code, because like, what are you doing standing up? It's a funny skin. They're like, did you call it code? The surgeon did, because the anesthesia stood up. He just stood up to kind of look, see what's up. They're like,
Dr. Jeneby Sim is
Airway
asking.
book chair. I like that. I've been telling Max to become an anesthesia.
Way to go.
I said I want him to get an MD, MDA, and do anesthesia.
Yes, Cindy, we do have a male
So I'll bet that
patient
you
today.
can beat Max's ass
Oh my God.
when he takes over. I think you're 10 years younger than me, right?
Yeah. Wait,
Let's see, I'll be 75 when he takes over. 75, Doc. That's
Hey.
gonna suck. Big one.
So if you're
I'll be
interested in seeing the
85.
full procedure right now, you can go to our YouTube. The link is in our link tree in our bio, and you can see the full procedure
Okay, we'll be ranging
there.
ordering somewhere, kicking everyone's butt.
Oh my God.
And if you have any certain questions, there's not really any guides. The guidelines are
All the
more
fingers goes gonna rotate where he spends.
not as restricting on YouTube, so you can ask a lot more questions on there if you would like.
It's good they go to the same place that is, but not many, everybody knows them.
Yeah, dude.
Yeah. Definitely want that.
He has 3 girls. Are all of them gonna do anesthesia?
The third one's gonna be derm.
Oh, that's a good one too. You
Welcome,
know what?
Charlie.
You're
Welcome,
best dad for a
B.
mom for a mess ball.
Welcome, Alicia.
You watch. Mark my words.
Welcome, Emily. Welcome,
Mark my
Vanessa.
words.
Welcome, Logan.
Yeah, mine
It's coming, Doc.
Welcome,
All germs get into
Amanda.
mess balls. Oh.
too.
Make sure you hit the get a lead button.
Yes, on our TikTok, we do have that blue get a quote button down in the bottom corner on the left-hand side. And you have the chance to receive 24% off your procedure with the new year. But you can only get that offer if you click that button during our live.
Only during our live.
Yes, Kayla, we are doing a lipo right now.
What we're doing now is the vaser breaks up the fascial planes and melts the fat.
Is he getting the Rejuvion as well, or just the
No, I
lipo?
didn't do Rejuvion. We should have sold that one too.
Yeah.
Dang it. My business, sleeping on the job over there. He's like, once I sold one, that's it.
No, when
The
he
roller's
was,
good,
he
too.
was like, contemplating on the exosomes, and I was like, are you sure? I was like, we did it for your wife.
Yeah.
And I was like, if you want that big juicy.
Juicy, you want the fat to live.
Yeah.
Plus, it's all about not wasting it either. We're pulling it out. We can put it
Because
somewhere else.
technically, when it goes in there, it's dead.
Yeah.
It's starting to die, right?
Mm.
There's some articles where people are taking ice that is sterile, in a nice sterile ice bath, and putting it in there to
Oh,
keep it from dying. Dying slowly,
wow.
and then the cold fat being reimplanted. Read that last night.
Oh, that's interesting.
It's interesting, right?
Yeah.
It's like Frankenstein. Actually, it is like Frankenstein, right?
Yeah.
It's dead in here. So how does it come back to life? We still don't know. So a lot of people are thinking that the dead ones recruit the alive ones just long enough, and then they die.
Yeah.
You see what I'm saying? So it's all stem cells and messages.
Yeah. We just keep
So we're just accelerating them.
Yeah. Yeah.
Welcome, Kitty.
Nobody really knows how they come. Do they really come back to life?
Welcome,
or are they
Rita.
replaced?
I would say they were replaced.
I think they're probably replaced.
Yeah.
Because how does something dead come back to life? Does fat really come back to life? Or does it signal one fat cell says, okay, replace me, and then that goes away?
Yeah.
But then you need all these signals.
Yeah.
Yeah.
That's why the exosomes are really helpful. Then also the exosomes tell, in an environment that is hypoxic, it tells the body to make blood supply to that area. Cool, right?
Yeah.
So it signals all kinds of cool things.
How long has exosomes been around?
Oh man. Over a decade. I think it's probably been more because somebody decided to use it in cosmetics.
Welcome, Tracy. Welcome, Stephanie.
You know what
Stephanie,
the
thank you for
first
sharing our
microwave is
live. We really appreciate that, and thank you for the follow.
called? Isn't that crazy? You know how they
Yeah.
found it? One of those big antenna operators were noticing that this chocolate bar was melting in his pants.
Oh, wow.
So they're like, what is this thing giving off? It was microwaves. All these accidental things, right?
Good morning,
Yeah.
everyone. If you're just joining us, we are doing a Super Daddy makeover
the
here in San
super
Antonio,
soakers,
Texas with Dr. Jeneby.
guns,
If you guys have any questions,
Yeah.
feel free to leave them in the
Back in the
comments
day,
below, and we will
the-
gladly answer those for
In the
you.
80s, the squirt gun was kind of just had a reservoir and a pump and a siphon.
Gina, in the bottom left-hand corner, there is a blue
A
Get a Quote
NASA
button,
engineer.
and you can schedule a consultation with one of our doctors
Really?
there, and we'll have someone from our team get in contact with you to give you more
Like
information.
Dr. Barlow.
Yeah, like Dr. Barlow.
How about Dr. Barlow? He just happened to just do plastic surgery as well.
Yeah.
Go back and become a plastic surgeon. He was like intern of the year at NASA or something. His
Thanks.
resume's insane. I'm
Welcome,
showing you
Neo.
You think he's rather intimidating, but he's not.
Yeah.
And just so you guys know, if you do press that Get a Quote button during the live, you will receive 24% off on your procedure for the
Oh, I know
new
there was a lot
year.
of hugs at the Christmas party.
But you can only get that offer if you press that button during our live.
Remember that, Doc?
Yes.
Show up, I went around her and hugged her like this when I first, she didn't know it was me. I just kept hugging her and she didn't see me.
Okay, it's not.
Yeah,
Awesome.
and she goes, there's only one man in this whole place that can do this.
Oh.
Of course, Gina.
She was about to shoulder throw you.
What's that?
She was gonna shoulder throw you.
Yeah.
Dr. Jeneby, if someone's been exposed to COVID but they're scheduled for surgery, would you still recommend that they go?
If someone has been exposed to COVID,
Like they might not have it, but they've been exposed to
They need
someone
to-
near it.
well, I don't give 100% advice
Yeah.
like video, but I would say, just to be safe, I would go check it out.
Yeah, I definitely agree.
I mean, if you're getting, this is not terribly a medical advice TikTok. But I would say if you have any doubts, I would definitely get it checked out.
Stephanie, go ahead.
Is that before surgery?
Yeah, she said she has surgery today. Not here. Somewhere in another office.
I would definitely call your surgeon and ask what their protocol is.
Yeah.
Hard for me to give you advice, not knowing it.
And then Stephanie asks, she's had bypass surgery and it's been
Gastric
1 year.
bypass, right? Not cardiac bypass.
Yes. She's lost 200 pounds and she's looking to remove.
200 pounds.
That's awesome. So Stephanie, if you click that Get a Quote button down in the bottom left-hand corner, we'll have someone from our team get in contact with you. So if you would like to schedule a consultation with us to get all that extra skin removed. And also by pressing that button during this live, you'll receive 24% off on your procedure for the new year.
It works. There's no question it works.
I've been hearing that it like eats away at your muscle too.
It does.
Welcome, Paul.
It does, but I mean, if you're working out, you maintain your muscle.
But it does, you lose muscle.
Lose a little bit, but you lose more. What's great about it is you don't have your cravings for food. It's kind of hard to explain. It really affects the
Stephanie, when you do the get a quote button, when someone from our team gets in contact with you, they can give you a better idea of what the pricing will be. They'll also be able to give you information about financing options as well.
Yeah.
So I highly, highly recommend filling out that get a quote form so you can get more information.
Amphetamine, heroin, alcohol. I'll tell you that it's hard for me to drink.
And Stephanie, just so you know, we are located in San Antonio, Texas.
It's fraud, right, Doc?
It is. It does, you just don't like, you don't train things like you
It's a really wonder drug.
Of course, Stephanie.
which is good and bad. I think you enjoyed your
Dr. Jeneby
Yes.
Muwari, I think that's how you pronounce her name. She's asking, does she have to wait a full year to get plastic surgery after pregnancy?
No, you don't, but I mean, we gotta see what's happening to your body, 9 months. Also, you're still lactating possibly.
Yeah.
So we have to wait till you're completely dry, so you can't be breastfeeding. So you're ready to stop breastfeeding at 9 months and pumping. Thinking about breast that has to be completely dry, no milk coming out at all. That's why sometimes it takes a year.
That makes sense. I have a question though. What happens when you say like someone in their 20s gets a breast implant, but then they have a child later in life and they decide to breastfeed? Does the breast implant affect any of the breastfeeding at all?
Say that again?
Say someone in their 20s gets a breast implant done, but then later in life, like,
As a kid?
yeah,
Oh,
does that
yeah.
affect
Depends
the...
on how later. They had it at age 20, they had a kid at 22, and their weight gain is nominal for, for a baby, and their skin may snap back and you're fine. But if you gain a lot of weight, or you're just unlucky with skin, then you may need a lift.
But does it affect the production of the breast milk?
Oh, I see, of milk.
Yeah.
There's a 3% chance that you cannot breastfeed.
Okay, well that's actually a lot lower than what I thought, so
Yeah.
that's pretty cool.
Especially if you don't do periareolar. You come in through the areola, you have more of a higher chance. I do under the chest wall, yeah. So I really don't mess with the lactoferous, they're called lactoferous ducts under the nipple. Doc, did I tell you I've got another 10-year certificate for my boards?
Yes, Gabriella, if you are on Manjaro before the surgery, that's totally fine. The patient that's in right now, he was actually on Manjaro and he lost a whole bunch of weight. So now we're going in today, doing some lipo, doing a reduction on his chest with all that extra skin. And then Gabriella, I think it depends on what surgery. She's asking, can you be awake during surgery?
Oh.
Something like this, no, but
No.
the touch-ups that you do where it's just
Touch-ups on
local.
Fridays, if you need a touch-up at 1 year,
Yeah,
99% of you are awake. It's really hard on your body to be awake.
yeah. Plus, like, it's a nap in my opinion, and you might as well
Right.
take it while you can get it.
Yeah, exactly.
Welcome, Sunny. Welcome, Tony.
300.
Welcome, Tammy. If you guys are interested in seeing our full procedure today, you can go over to our YouTube channel and check that out. The link for our YouTube is in our link tree in the bio. Also,
300.
don't forget to press that get a quote button if you're interested in getting a procedure done with us. Because right now we are having a deal where if you do that get a quote button during the live, you will get 24% off on your procedure.
Does Simran know where she wants to go? Back to Houston?
Probably come back to Houston, I think.
You're gonna work at Bentov and get cut her teeth?
Tammy, I think it really all depends on what kind of procedure you get. But our doctors also make sure that the patients have the option for the pain medication and stuff like that.
You never know.
Yeah.
That would
And
be
then it also
independent,
just depends on the
right?
person as well.
Chest anesthesia. I hope it stays that way when you finish it.
I think it will be. Because all these big corporations are breaking up again.
Yeah.
Hi
You'll have your own
Lacey,
group,
welcome, and thank you for the follow, Lacey.
That's insane, right? KAC LLC.
Yes.
Then you can negotiate for them.
They can negotiate for me. Those are the dudes who are in charge.
Welcome Lala. Welcome Claudia. Welcome V. Dr. Genevieve Sim is asking if you allow for resident observers or
Observe for a day, provided the patient's okay with it. Most of them are. You gotta bring black scrubs. So usually like a day. Just because I move around so quickly, I have to run all these businesses. It's hard for me to sit with you, give you time. Have a nice about a liter for this guy. All this weight loss.
Yeah.
You lost 80. How much have you lost so far?
So, since I started with you, I lost 20. And then since I started on Jaro, just 10. So
You know what you got to do at night? Switch to seltzer. Those are empty cows. And sugar. One drink is, the drink that you do, is fat calories of a donut. So, you know, once in a while, when I see people stalled in Korea, you know, they're like, I can't, I'm like, I'm going to drink it.
Yeah.
Okay, I drink 2 glasses of wine. 2, okay, maybe 4. 4,
maybe the whole bottle.
okay, maybe 6. 6? There's only 4 glasses in a bottle. So there was an experiment between a male and a female that I did a long time ago. It wasn't an experiment, but they both had gastric bypass. They were married. The man put out liquor, and he lost a ton of weight. The female gained it all back. She was drinking a big of wine every night.
Yeah.
So she gained all her weight back. I saw that.
Yeah.
That's crazy.
It's so you get all these like, every time somebody's not losing, I'm like, how much you drink on the weekend? They're like, nothing. I'm like, nothing.
Like,
Okay.
this is a safe space, you can be honest.
I'm like, I'm your doctor. You want to know some things?
I drink like 2 to 3 times a week.
Huh?
2 to 3 times a week, I drink.
So maybe, you know,
I drink
cut down 1.
Monday to Thursday and Friday to Sunday.
That's 2. No, but if you plateau, watch. Let's take out like Ashley, who's plateauing her weight loss, and she likes real Coke. Stop might possibly the worst thing for you.
Yeah.
The Coke.
Yeah.
Like, have you ever seen they put it in a pig's stomach and they opened up the pig's stomach? It was like dead, basically.
Yeah. I remember in school,
If you're
they did the
plateauing-
tooth one. They dropped the
Plateauing,
tooth.
consider a vodka club only. That's what the bodybuilders. They have to have a drink, they do vodka club.
That's what I drink when I go
Gin.
out.
How about gin?
I do.
Gin,
Gin.
just a real light gin, club, and a lime. No mixer, no OJ.
Okay. Yeah. I like that sweet cherry liqueur. Man.
Oh, hell no.
No.
Yeah.
That'll stimulate your pancreas to do all kinds of bad things. So I ask people, okay, you're at 185, tell me when you eat, and when you eat, what you eat,
Yeah.
when you drink. I don't drink. You don't drink? Yes, okay, I do.
Yeah.
Hey, don't lie to the doctor.
But that phentermine, man.
No,
So
phentermine is ultimately, you talk to cardiologists, 400 doc plank. You talk to any cardiologist,
Welcome,
you
Wix.
need a valve,
Welcome,
open heart
Lisa.
valve replacement. AVR.
Yeah. I
You
did
don't
it for 2 years.
Welcome, Amy.
I lost 70 pounds.
If you guys are just joining us, we are currently doing a super daddy makeover here with Dr. Jeneby here in San Antonio, Texas.
Dr. K and I would be
If you guys
like,
have any
"Yo,
questions, feel free to leave them in the comments below and we'll gladly answer them for you. Also, if you're interested in scheduling a consultation or finding out more about what we offer for services and finance options, you can press that blue get a quote button in the bottom left-hand corner.
Yeah. We changed mannequins.
Yeah, thanks, but no thanks."
And you will be able to receive 24% off on your procedure
Okay.
if you click that get a quote button during the live. But you can only get that offer if you click that button during the live.
During their season, which they don't.
Welcome, Jax. Welcome, Robert.
I'll do like one gin and club, or vodka club.
Yeah.
Find the one that has the lowest sugar.
Okay.
And vodka technically does, because they don't
Yeah.
distill it, they distill it, they don't ferment it.
Yeah.
And tequila has a lot of sugar.
Oh,
It's
yeah.
not my favorite. Yeah.
Yeah. So that's how you get rid of the plateau.
I will say, if you do drink a lot though, like if you're like, we're gonna go out, we're gonna go have fun, activated charcoal, put it in your drink. It won't change the flavor or anything, but it helps coat your stomach so you don't feel as nasty the next morning.
Another thing is, the Chinese researchers did this, and they looked this up, but apparently Sprite inhibits the formation of aldehyde from alcohol. So, you know, that's why you feel like crap, because you're basically embalming yourself
Oh my gosh.
for formaldehyde, right? So alcohol gets converted to aldehyde, that's why you have a hangover. So they found that regular Sprite, which has a lot of calories, but a little splash, will reduce your hangovers.
Okay.
So at the end of the night, start drinking, you know.
Sprite instead of water.
Dash of Sprite in there.
Yeah.
Yeah.
I don't know why the Chinese researchers were on that. Maybe because they were getting hammered.
All that sake.
All that sake.
Oh, and that Japanese. That's my favorite.
200. Knock upper back. All right,
Yes,
we're
Scott, I
ready to
agree. The
plug
full glass of water before you go to bed
in.
after
Beautiful
a day of
pair scissors on the
drinking.
floor. Dr. K threw it down there. Anesthesia fall.
Always, help ourselves.
Anesthesia just likes it.
Are we gonna need all these,
Oh, we need the exosomes. So hey guys, this is what exosomes looks like.
I'm just showing it on YouTube,
Okay.
just to be safe. And we've got 4 people in YouTube right now, so.
Okay.
Let me get a little
Oh yeah.
alcohol.
Yep. We're going to be taking his butt and increasing the. I got to give him, on a man, you want to keep it oval and muscular looking. You don't want to give pips. What's Rocket doing next year? Brachioplasty and everything?
Yes. Yeah,
Oh,
it's a
yeah,
big
yeah.
one. But we were anticipating you would be first to be finished today, he would be
All right.
second.
Yeah, 'cause my next one's an easy one. Just the tummy BBL. Okay, there's exosomes, it's clear, colorless, odorless. And we're gonna mix it up. This is gonna help bring blood supply to the dead fat, which we're now re-injecting. Pretty insane to think about how this works.
Yes, Scott, the patient is under anesthesia.
front, we do vaser, and then we need all of this front.
Okay.
What we're doing now is mixing up the exosomes. So doc, about 500 per bud, okay?
Okay.
Actually, we'll do 600 on the left and 400 on the right.
Look at that. Okay.
Thank you for giving me the big tubing.
Yeah.
Not the training tubing, starter tubing.
It was in the bag too. I said, no, I'm gonna save it
No, I'll use it, but dang, if it's all we have left, I'll use it. I call it the training wheels tubing.
Okay, you ready?
Yeah.
He's fully under. The patient is getting a
I'm gonna pull this out.
BBL 360 lipo and a chest reduction.
Put me in room 2.
So with the amount of procedures that are being done today, it's
What is this, doc?
way easier for him to be fully under, since
You
it's
would
going to be
show me
so hard
this,
on the
like,
body.
at Wurzbach, I'd be like, wow, look how big this place is.
Welcome Calvin, welcome
Me and Kay
Lisa,
like to like hold hands and look out for me.
welcome Callie,
Mainly Kay does.
welcome Danny, welcome
I
Jessica.
go to the internet, doctor.
The internet. Live on the internet. Ready?
Yep.
Excellent, good job. This fake tape is better than the clear tape.
That's silky stuff.
Thank you for the follow, MC. Welcome Whitney,
Doc, here we go.
welcome Cammie, welcome B.
Turn back up.
Yeah. turn
If you guys
back.
have any questions, feel free to leave them in the comments below. We'll gladly answer those for you. And if you would like to see the full procedure that's being done today, which is a Super Daddy makeover, you can go over to our YouTube channel where we're streaming the full procedure live.
Lower pole.
And to find that link, you can go to the link tree in our bio and click the YouTube
So
button.
when you say lower pole, are you
Like
talking
right
about-
here, yeah. So that when you put an implant in,
Also,
you can't go past this.
If you're interested in scheduling a consultation or just finding out more about the procedures that we offer and what financing options we have, you can press that blue get a quote button down in the bottom left hand corner. And when you do that during the live, you'll receive 24% off on your procedure or
More
procedures.
balance, harmony, as such.
Yeah.
Welcome Jane.
All right. Are you good right now?
Yeah, I'm good, thank you.
Okay. I'll be back in a little bit.
Yep, no problem.
Put some,
Welcome Amy.
Doc, January 27th, ask Shopa.
I cannot come, but I'm not sure yet.
Welcome
Okay.
Leah.
Hey Doc, I did about 500, and I'm gonna save the rest.
Okay.
We're gonna go on the right.
Thank
now.
you for the follow, MC.
Yeah.
Welcome Ava. Welcome Levi.
Those exosomes are now gonna start working within 12 hours to signal the body to bring blood supply to the now dead fat cells. Rather impressive technology these days. And apparently, according to, what's the law that everything doubles in technology every 10 years?
I think
What's that
so.
called? Something called, not Murphy's, but.
I know what you're talking about, but I can't
Okay,
think of the
Doc,
name
500.
either.
Got it?
Turn back.
Here we go.
Welcome Matt.
So we're gonna go 600 left butt, 500 right.
Welcome, Sylvia.
Anyone know that law? All right, Doc, we're done.
Love it.
All right, guys, we're gonna flip. You guys have 10 seconds to hit the, we're gonna count down from 15 so that you guys can do the 24% off or 24. Have to do it during the live. Deanna is going to be texting this to Brenda and all the crew. We're trying to get
Alrighty.
quite the nice people to be talking to. Brenda is bilingual as well. Hablamos español también. So
We got
hit it.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Thank you.
Thank you guys.
You want to do a live?